things might have been different for each of those women had all the programs we have now today been present then. And the first woman with the cervical cancer, she would be one of those patients that you referred to earlier that just won't go for testing, didn't go to the doctor.
No one wants to talk about cancer, but no matter how healthy you are feeling or how busy you are, according to my next guest, it is important to take the time to screen for cancer. Welcome, Dr. Langley. I'd like to thank you for coming to the show, and I want to ask you what your medical background is.
Sure, April. I'm a family physician. I came to Kingston late 70s, I suppose, and finished medical school in the mid-80s, and then did a residency in family medicine and have been in Kingston ever since. So my practice is general practice, but now I work at the regional cancer program helping promote cancer prevention and screening activities.
And your name is on some of the screening material that I receive in my mail.
Yes, I've been fortunate to work for the Ontario breast screening program now for 15, 20 years, I suppose it's been, and many of the letters, they've changed recently, but up until recently, a lot of the letters to women in Kingston inviting them to come for breast screening were signed by myself, and the result letters back as well. So yes, there's a lot of women in the Kingston area that have letters from me for many years about the importance of having mammography for breast screening.
There are other cancer screening initiatives and happening right now as well, but let's go back to why is it important to screen for cancer?
Sure. Screening is important for a number of reasons. The first is that we've learned with breast screening and cervical and colorectal cancer screening that when you find a cancer at an earlier stage, before a person has a lump or a symptom, those cancers are much easier to treat. The treatments are less invasive, and the outcomes, the benefits as far as lifespan and general well-being afterwards are significantly better. So the first real screening started mid-80s for breast cancer screening, and since that time we've seen a marked reduction in breast cancer mortality, and that is likely the result of early detection through screening, as well as significant improvements and changes in treatment of breast cancer that we've had over the last 20 to 30 years. So the importance with breast and now colorectal and cervical is that we tend to find cancer, even in colorectal cancer, we find precancerous lesions, and in cervical screening we find pre-cancer lesions, and those can be very easily treated. So the message is early detection saves lives. It gives a better prognosis or outcome after treatment. So that's why we promote our 3 provincial programs year-round and during special events like these to try and encourage women and men to come for testing. And they're coming for testing when they feel entirely well, no symptoms. So that's for some people that's a new thing. You know, it used to be you'd go to the doctor when you felt sick. Even when I started, that was, you know, people came when they had problems. Now, family doctors and nurse practitioners see patients when they're coming in feeling entirely well for their blood pressure, their cholesterol, and their breast screening and cervical and colorectal cancer screening. So it's a change in the way we look at patients and hopefully the way patients look at themselves and their family members.
If someone is asked to come in for a cancer screening, why would they decide or choose not to come?
Well, that's a question a number of researchers have looked at for ages. So right now, breast screening is recommended for women over 50 up to about age 74, and about 25% of women just don't go. And it's likely a combination of reasons. In Canada, it's not access. Patients, the screening is included as a part of our insurance plan. They're usually conveniently located, so it doesn't appear to be getting there or funding of the procedure. So the next could be fear. Many patients or people have a view that what they don't know won't hurt them and they just rather not know. Or for some patients, they may have many other diseases or other conditions or difficulties in their lives where going for a mammogram just isn't the highest priority. But we try very hard to get those patients. These are patients that have never been screened, to try to convince them that it is a good idea to find out if something is there when we can deal with it early. But I think there's a fear and apprehension. At times, it's a lot of testing. For a woman at 50 years of age now, we'd be recommending them be tested for breast, cervical cancer, and colorectal cancer. So it's a bit of effort and knowledge. The other is still we're finding we do health fairs and boat shows and things, and we still find people coming that really aren't quite aware of the screening and what it's for and why they should consider doing it. So there is some education too, and through Cancer Care Ontario and our regional cancer program, we've trying to get the message out to patients through advertisements, through invitation letters. We have interactive websites, as does Canadian Cancer Society, that'll help patients understand why they might want to consider cancer screening. So hopefully we're starting to get the message out and we're getting our cancer screening rates up in those that just won't come.
Are there hot spots in areas that you would like to see more cancer screening done?
Yes, it is important. If I think, let's take cervical cancer, for example. In Ontario, every year, cervical cancer is not terribly common. We have over 600 cases per year, most requiring surgery. But the unfortunate part is that there are over 150 deaths per year still in from cervical cancer in Ontario. The number is decreasing every year, but we're still left with a significant number of deaths from a largely preventable disease. So right now, cervical screening, pap smears, should start at 21 years of age. The vast majority of women that develop cervical cancer have either had irregular pap smears or none at all. So I would really like to see cervical screening go up to 100% of women eligible. It's less frequent now. It's every 3 years instead of every year. So the guidelines have changed. It's a simple test I'm told, without pain. It's a 2-minute procedure with a nurse practitioner, a nurse or a doctor. So it's very simple and it's widely available. And I think if every woman over 21 had appropriate pap smear screening, we could see that number of 600 to 650 drop dramatically. So that's an area. Another area, the rate of vaccination for human papillomavirus. Now that's a virus that we know causes cervical cancer, and we have a vaccine for that virus. So in effect, a cancer vaccine, which researchers have been looking for decades. But the vaccine being free and given in grade 8, we don't have 100% of the young women coming for the vaccination, and the rates have gone up dramatically in the last 2 to 3 years, but it still isn't 100%. So I'd like to see that change as well.